Raymond from EPHA to come back onto the panel to help us reflect on the way forward, what we've found useful from the day, and also this is an open conversation with you, the audience, to understand. It's been sort of an incredible roller coaster of a day with lots of information, experience, ideas, questions, challenges to ourselves, and I'm sure everyone needs a little bit of time to process and digest it. So that's what I'm suggesting we do in this last session together, to see where do we go from here. We've had an open invitation from the two co-organizers to say, let's keep the ball rolling, let's keep the conversation going, let's see what the next topic we should discuss and explore. Let's see how we develop further the role of civil society, how we do within the UN family, the interinstitutional engagement. So this last half an hour is a co-creation of what next, how do we do it, and how do we build on that. So first of all, would any of you like to say a comment on how things have been today? If something is immediately obviously say, right, I can see we need to go work on this, that would be very helpful. Or were you surprised by anything that you heard? Please, take the microphone.
Is it on?
Yeah.
No? Yeah. Actually, I want to come in with a question. And I mentioned in the very beginning that this event is very much meant to break down silos. Mm-hmm. I come from public health. Actually, my background is in nutrition. I've worked in science communication for a long time. So still, this field is very new to me. So when I was listening to you, Rachel, I kept on thinking, okay, you mentioned some of the things that you are doing, right? You mentioned that you must be doing capacity building with member states. And then you mentioned some of the practical examples. But for me, I was still seeing this black box. So for example, could you maybe share some details on when you do indeed work with a member state? Let's say you're working with a health ministry in a country. How would you work? How does this go? And then also, what could the role of civil society in this potentially be?
So, from the global perspective, I'll give you one very practical example. We had a member state that wanted to bring this issue of childhood immunization to the Human Rights Council. So we were working with one of the permanent missions to all of the UN organizations that are based in Geneva. When you bring something to the Human Rights Council, so it's one of these human rights bodies, you have the opportunity to get different studies done on this, to set new norms at a global level, and really focus the attention of different United Nations bodies and also the member states and their ministries on different issues, because somebody will go out and start asking questions. What we have to do is really quite boring in some ways, and it's more to do with sort of a global health diplomacy, understanding where we can put that question at this time, which member states are actually interested in a particular issue. So, because this is public knowledge, we know that Brazil is very interested in vaccines and understanding also a lot about access to vaccines, from the intellectual property issue down to the very much who is getting access. And because Brazil is an incredibly diverse country, recognition of the different challenges for indigenous peoples, people of African descent, etc. So we need to work with our colleagues at the Office of the High Commissioner to say, this is a super important issue. Our vaccine colleagues are telling us there are so many children who are 0 dose on their under 5 immunization schedule. This is really grave. So we need to, how do we do this? So there's a lot of back and forth. Well, would Brazil like to talk about this? Would the other country like to talk about it? What experts do we need to get there? What evidence do we need to bring to the Human Rights Council so that somebody will either bring forth a resolution or ask that a study is done? Once we have that sort of, it's not exactly a legal basis, but it's a basis to act on, you can send people out to go to different ministries in countries and ask them questions. They can also go and ask civil society questions. They could ask EPHA questions to understand at the European level, where do these, and so that data, that evidence then gets fed back up to the international level. And then they try and put in place something that should be implemented. Often just the act of asking those questions has a minister prodding the lower down people to do something, and it often provokes a degree of action or response. It doesn't necessarily, and that is our huge challenge, is getting things implemented. We've got a lot of this, Mila noted earlier, so many different norms, guidance. The implementation is a challenge. So it requires that we're creative in using the tools that we have in a toolbox to be able to do this. Thanks for the question.
Yeah, thank you.
Yes, go ahead.
Yeah, I would like to thank very much Rachel, because it was very honest, your presentation. I feel it like that, because of course we can show the organization on the positive side and how what we have implemented and what is successful. But that is very good to also listen to how we can help, because in each organization, and moreover when it's a big organization, you need also other partners. You need to work on a very difficult subject with partners, and it's really interesting to hear this kind of presentation. Wanted to say it. Thank you very much.
Thank you. Yes.
I promise that this will be my last question before you kick me out. So, Michael, it's a comment or maybe a question that, you know, we have been discussing about all these important and very relevant issues. And because this session is about engaging for change, I was wondering that in this important issue and important decision, I was wondering that there could be a discussion about media engagement, you know, and it's very important, because I think from policy perspective, because we are all discussing about policy and everything, it goes hand in hand with media and dissemination. So I was thinking that media in all forms, you know, be it social media or digital media or print media, how could we actually give momentum to media in coming years to actually not only to raise awareness about this important issue, but also to generate more willingness from political and legislative bodies, but also to drive change in terms of policy diffusion and dissemination, like in coming years. Do we see that happening, or is that in pipeline from European institutions and even from WHO side? So.
Thank you. That's a great question. So, you know, twinning this with a media outreach and a media engagement strategy is a question. I don't know, Raymond, if you can say something about EU level, because I'm not sure that WHO and OHCHR can respond on the EU, but maybe you can.
Yeah, well, maybe I can, not necessarily from an EU level, but maybe more from a kind of a fellow NGO perspective. I think, you know, media, social media are a very important tool for us to use, to disseminate, to engage. I think at the same time, I mean, it is also a channel through which you convey your identity, right? The type of organization that we are. I think if I speak for EPHA, we want to be very science-based, very constructive. So we would not necessarily use it in a first instance to, you know, kind of shame and blame. So we will try to use it very smartly, very constructively. Because I think that is what you were kind of maybe hinting to as well. That for us, for EPHA, that will be kind of a less resort, I think, because usually then the door is closed, right, for good discussion. Yeah.
And something that super important that I failed to mention. So some of you have picked up the 75 years of the Universal Declaration of Human Rights. Should be ashamed to say I failed to mention this is the 75th anniversary of the World Health Organization. So that's big for both of our organizations. And yeah. So we are coming together with the High Commissioner for Human Rights, who's inviting a lot of different UN agencies for Human Rights Day, which is the 10th of December. I think we will do it on the 11th, to make different pledges, renewing our commitment to human rights, because 75 years is quite a long time. You read the original Universal Declaration of Human Rights, and it talks about how marriage is between a man and a woman. We've evolved our understanding of human rights since that time. And so we need a recommitment, we need a rethinking. And I mentioned originally, I mean, institutions perpetuate racism, discrimination in all its forms, but institutions can also change. And human rights is one way in which they can change. So we will have a 75th anniversary campaign, social media campaign, trying to get younger people engaged. And we now have a WHO Youth Council where we try to get young people understanding what it means to claim your right to health. So it's going to be a bit like an Office of the High Commissioner for Human Rights campaign about know your rights. What does it mean to say that you have a right to health? So we're trying to come up with messages around that. And we're going to be engaging in a dialogue next year, trying to bring civil society actors to WHO so that we reach a little bit out of what has been our traditional comfort zone of just looking at scientific evidence and understanding that other forms of evidence are also very valuable.
Thank you very much. I wanted to come back on the topic of media engagement and the importance of media. And before this ask, we're already moving to the part of including, like making the list of final conclusions and recommendations, this document that we will share with everybody and ideally also with policymakers. Indeed, it's a topic that must be there. It hasn't popped up today, and I was surprised at a certain moment. I was thinking that we didn't touch upon, and good that we didn't, because it's completely different line of work on hate crime and hate speech. Just a couple of weeks ago, there was a very big event hosted by the Spanish presidency, and there was also the anti-racism coordinator and many other colleagues from European Union level and state level, speaking of the importance of media for disseminating or stop disseminating hate messages. And the importance of all platforms. So if we can include this topic in our final list of topics on which we have to follow up, on one side, there is, of course, the topic of measurement. There are illustrative indicators on the right to freedom of expression and opinion. And this whole discussion of where freedom of expression starts becoming, well, where is the limit between freedom of expression and opinion and hate speech, because hate crime is better defined. And then one very important topic is not only what media say, but what media do not say. And there is a whole set of indicators. Once you start contextualizing them, is what you do not cover, what you do not say, what never comes on the first pages of media, which is important topic to tackle. And then really pay very close attention where, I don't know, like about you, but it's like most of us are generation that does not follow trends on social media nowadays. Do you realize how difficult it is to educate on the importance, for example, of health prevention and vaccination when you have social media like Instagrams and TikToks where you have huge masses of people speaking against this? So what is the power of public health institutions and WHO and any other actor in front of this very fast moving forward media, if it can stay on our to-do list? Thank you. Thank you.
Jackie, you wanted to say something, please.
I do. I wanted to add to the list, actually, if I may, because one of the things that we talked about at the beginning was in the Disco Network was this whole thing about language. And it's something that certainly within my organization, ARZO, we had to run what PR people call a rebuttal campaign, because there was not just misinformation about obesity, but actually disinformation. And we're seeing a lot of that, to build on what you were saying, Mila, just now as well. And what's really important is that when the media or any policymaker for that matter
wants to express or communicate, they basically take copy paste. Whatever the official copy paste text is, that's what we use because there's a lot. So I think that we need to, as part of our to-do list, is perhaps build on that particular element from the DISCO network and start thinking, how can we have a common, accurate and precise language? So not just narrative, but actually definition, scope, contextual usage, which we've just spent a year working on that for obesity. Happy to help. But it means that when the media decides to have a story, it's not going to be actually inflammatory language, which is the case. It's not going to be imprecise terminology. So we all just keep scrolling because we're too embarrassed to say something. It needs to be something accurate that we can all get behind, so that when someone is picked up on for interview, which will inevitably happen, we're clear on how we express ourselves as well. So that to me is a big to-do.
Thank you. Does anyone else want to share something? Yes, please go ahead.
I think the role of civil society is very important in this whole issue, because when you look at how policymakers, and I'm thinking at the political level, for them very often they are constantly managing a limited budget, and there are an enormous amount of demands of different groups who want budgets for some kind of implementation. And I think that civil society can put something on the top of the list. And this is incredibly important, I think, to do. I think you're always working in a very competitive environment as a politician, which I'm not, to make but my wife used to be an advisor for one of the ministers in Belgium. We have very many ministers. And she said it's incredible the number of files they send to you for all kinds of important things. And you have to manage and civil society can play an enormous role there to get your theme on the top. And I think this is a very important theme. So I hope that civil society will play its role.
Thank you. Can I just put a challenge to us all, which is that, and it's perhaps a bit unfair to do this in the last 15 minutes or so, which is all day we've been talking about human rights and health and a human rights approach, and I totally believe in that, and I think that's totally legitimate. But in this area, I see that quite a lot of politicians are almost allergic to the idea of human rights. The word, the frame, because the implication is human rights for some means everyone else is losing rights. And if, we heard earlier that in some European countries with populist leadership, migrants and new arrivals in the country are their favorite scapegoat. So if we start saying, well, this community should have rights, the implication is everyone else has fewer rights. And I just wonder how, as a community, we reflect on that going forward, messaging and narrative. And thank you, Jackie, for saying we need to have an agreed lexicon, because, otherwise it's very easy to end up falling back onto the defensive, and there will be political friends and there will be political foes when you want to talk about a human rights approach to health, whether it's a human rights for people with different sexual orientation or anything else. There's often a really strong pushback. And so how do we address that? Jackie, you've got some good ideas.
I do, though.
And as has Dennis, great.
Okay, so it was a bit that I didn't get to mention during our panel, and that's basically so within EASO, as I said, we faced a lot of this as well. And so what we started, yes, it was me who wrote workarounds, and it was literally because we were able to start seeing that there was some policy/legal barriers to implementing obesity under the NCD framework. And so instead of talking about human rights, where, in a far right, quite frankly, populist environment, good luck with that. In the EU 27, good luck with that. Rights-based approach works really well outside of Europe. There's always some kind of a discussion. So instead, what we started looking at, and we had the meeting, the technical working session last week, we established a pattern of behavior by national EU member states. We can cite at least 5 of them. whereby they're actually in breach of their legal obligations for access to health service delivery. These are internal market rules. And, you know, we established that pattern. So now at EU level, we can actually add value. We can actually work, for instance, with the likes of WHO or DG Reform to actually go in and build capacity to look inter alia at overcoming those policy barriers. DG Reform is already doing that. They gave us the example of Slovenia, where their policy barriers to stopping access to treatment for childhood obesity. You know, so we weren't the only ones to start thinking about this, but we have established a pattern, and that's what we need to be able to do. It's not just about, you know, human rights. People have different opinions about that. Legal rights, they're very clear sanctions, and ones which people cannot deny from an EU perspective can be directly applicable in country without having to go all the way through to the court of last instance, where most regular people give up. So, you know, be creative, find those workarounds and find the legal rights.
Thank you. Dennis.
I think it's for us, it's been almost a case of trying to build a coalition of the people who get it. So in terms of countering the politics of clinicians and researchers, all the data from ECDC has enabled us to make a very compelling argument as to the public health benefits of treating everyone, for example, or the economic benefits of treating people while doing prevention so that you avoid meeting people at the point of crisis. Or indeed the ethical, you know, argument. At the moment, when we look at HIV specifically, in Europe, even some of the developed countries like Norway, you know, there are laws that are barring people from accessing treatment, despite the fact that they can be screened for infectious diseases, for example. And so it's kind of strange in Europe, you know, modern Europe, to have still 9 countries barring people from accessing treatment on the basis of their immigration status. And so our argument has always been, we need to have make the economic, public health, and ethical argument around why everyone has to have treatment. And so the clinicians and the researchers have helped us do this, have these conversations, you know, because I think they are listened to more by the politicians because they're experts. So yeah. I think that has been good.
Thank you. One of the things that strikes me is actually how much the language has changed. And when we were the EU anti-racism coordinator, you know, was able to say very clearly, and we heard that also from Stefan Schreck, for the first time, and I've been involved in public health at European level for 20 years, to acknowledge that racism has an effect of violence, of trauma, of PTSD. This is new language. It is an acknowledgement of the depth and the impact, whereas previously it was just considered, well, you know, it's discrimination, it's not very nice, but really that's the end of it. Just so I can see that there has been a real evolution of content, and I'm sure this is partly due to the work that WHO has put together. The OHCHR has also sort of helped to highlight that these are grave circumstances, but I see that as a progression and a change in the language, which is quite positive, and that's an angle perhaps to take forward. I don't know if anyone else has noticed that or wants to comment on that. Luna, did you want to say something? I mean, this is just a personal view that I have seen that language change, and I would not have thought that you would get official documents recognizing this level of impact. So that is a huge progression and a window forward.
Okay. For me, it's a thing on DSM-5. I mean, literally, where, yeah, I mean, so international norms, the mental health and neurological disorders, I don't know what DSM stands for, so it's DSM-4, DSM-5. And yeah, I noticed in Belgium, for instance, that under DSM-5, you're then entitled as a person of lived experience to claim under disability rights if your life is affected. So basically what we've seen, to go back to what Rachel was saying, that from this idea of, you know, human rights as translated or transposed into international norms, signed by legally binding conventions, it's all filtered down into both national as well as regional rights, legal rights, to access various treatments and support subsidies as well. So I think for me, that's plus of course COVID helped, but that's really a big thing, that people are now more open to talking, and because of COVID and other, and also most importantly, because there is actually the opportunity for legal redress. If there is no opportunity for legal redress, what's the point? You just sit there complaining and become even more depressed. But now you can actually do something about it.
Thank you. We're coming to, yes, please go ahead. I've got 2 inputs. Yes, introduce yourself.
Hi, I'm Rosina Spinoa. I'm an active member of Mental Health Europe and also a sort of active citizen when it comes to mental health advocacy. I'm going to mention a little bit of the elephant in the room at the moment if we're talking about human rights and mental health and what I'm seeing, and also racism. And of course, with what's going on in the world at the moment, I can't deny that for me, it's affecting me on a mental health basis, that I'm seeing human rights violations right now happening, obviously, between Israel and Gaza. I have to mention it. And when it comes to racism, I feel that I'm taking this on in myself because I'm seeing disparities when it was compared to the Ukraine situation in Russia. So I'm taking that on board, let alone my 3 teenage sons, one of whom has mental health challenges, which I had the pleasure to speak about at the World Mental Health Day conference that the EU Commission held. But I'm seeing that my sons are also witnessing a lot of human rights violations. They're older teens and also nearly 20 years old, on what they're seeing across social media with children with limbs, you know, coming off, and children that are dead and all kinds of crazy things. And I feel we're sitting here talking about anti-racism, discrimination and human rights when this is going on right now, and we're seeing violations right in front of our eyes. So just want to put it out there to the panel and what we think about that, because that for me is also a human rights crisis, racism, mental health, and health, everything combined.
Can I just quickly, yeah, of course, respond? I couldn't agree more. I have children as well, and it's very hard to try and explain to them how the world sits by or encourages some of this. But to put my UN hat back on, the WHO Director General Tedros has been using his mandate to call for an end to this violence, to the end of firing missiles at ambulances, bombing hospitals, bombing people. So he always takes this health perspective, saying, in this case, under international humanitarian law, which applies during conflicts, you've absolutely forbidden from doing this. And we know that various UN special rapporteurs and independent experts, including the UN independent expert on the special rapporteur on the right to health, has joined with other UN mandate holders to condemn and call for a ceasefire. This is also going back a little bit to this, what does the UN mean for young people? 75 years later, do these human rights treaties, conventions, and promises mean anything when we see what we're seeing going on? How do we renew that commitment? And the UN, how do we make it so that something that can actually respond to the demands of most people in the world who just want peace and to be able to live their lives in peace with their children and as healthy as they can be?
Thank you for that answer, Rachel, but I just want to address the racism aspect of that when it comes to perhaps some of the deep-rooted things that we're seeing that are vested in colonialism. And, you know, why would still a Ukrainian life matter when I've heard the narrative from the Commission come out that there's deep human rights violations and war crimes when it comes to Ukraine? But black and brown lives don't seem to matter as much. For me, there's an element still of racism in this.
Yes.
Have to say it, call it out. This is what it is.
But I think it's also the media that you might listen to. There's been a lot of different media condemning what has been happening in Sudan, calling this a war that needs to be ended as well. It's not just a civil war. And there are many different media outlets that have condemned this. African Union has, maybe it's the African Union's role to condemn that, and it's the EU's role to condemn Russia, Ukraine, but not denying that there is, well, there is a double standard in a lot of this, and particularly within the EU. I mean, you look around at the faces, it makes sense, but it's not where we need to be.
Yeah. Thank you.
Sorry, stealing. Go ahead.
I'm aware that we're at the end of the day. It's been a long day. It's been a great day. Before I close it off, can we just show again the Slido that showed? I asked, what country or cultural ties do you have, just to get a sense of, the rich fabric of the people made up in this room and online. And there you can see some of it, the extent to which, we have connections and relationships across the world. And this is part of what made our conversation, I think, so wonderful and so meaningful, because it brought all of these different elements, these cultural stories and identities to our conversation. This is the richness that we have when we come together as communities. So I just wanted to remind us that this is what we can bring together when we add things. I'm going to very quickly make a list of thank yous, because this event was absolutely fantastic. And then I'll ask you if you'd like to have a final word. Let me just briefly just mention all of our speakers so we can give them one round of applause to say thank you, because they've done a great job in making the content today. So we had Elena Kunturi and Mila and the team from OHCHR. From the EPHA team, we had Milka, Ray, Luna, and all the supporting team behind. We had Samira Rafaela, the MEP from Renew Europe. We had Abhi Devananayagan from the UCL, Emily Borgiat, Marie-Carmen Cortez, Hans Verret, Stefan Schreck, Michaela Moore, Dennis Onyango, Fatima Awel, Jackie Boma-Buzato, and Rachel Hammonds. So can we just say a warm thank you to everyone who contributed today? Any final words, and particularly from Ray and Mila, where do we go from here?
Where do we go from here? So this will be followed up with a formal kind of summary and presentation of next steps. Throughout the day, I mean, summarizing it would not be my competence, but what I did do is I was writing down some comments, some main messages, some quotes throughout the day. I will give you a very short selection of it. So in the morning, we spoke mainly about health. We heard that racism kills. We heard that minoritized would give a more actual or actionable definition of social exclusion. I need to go through because I don't want to mention them all. We heard about intersectionality, of course, throughout the day. About stigma and prejudice when it comes to Roma women and girls and why they have many kids at an early age. We heard that Moroccan women in Belgium have an 8 times higher rate of diabetes. We also heard that diversity in the healthcare workforce increases confidence and trust, for example, when it comes to the collection of equality data. Diversity, unfortunately, is just a footnote in medical curricula. We heard about the equality strategies in Europe. Of course, we heard from the international arena, the International Convention for the Elimination of Racial Discrimination, that racism discrimination manifests in different ways across countries. Let's see. We heard that in the EU Anti-Racism Action Plan, currently the paragraph on health isn't very strong, but it's still a toddler. We need to get past the feelings of doctors who we should not hurt the feelings of when we speak about this topic. We heard that racism can be very exhausting. That the lived experience is crucial to bring to the policymakers and not to put the responsibility to the individual. And we heard about accountability. And I'm going to split here. Thank you.
So what we will do is collect all the input that we received from you and from all the speakers and all the input that we received in the Zoom chat. We will try to systematize it and distill it as much as possible. I don't know, Ray, if we can probably aspire to have checklist of like probably 1 page of topics that we have to keep on highlighting. Some of them, because there are so many, we cannot cover them all, but some of them have to do with data collection, citizens' participation, victim support. The topic has been coming up slightly today, but not too much. Okay? Victim support, intersectionality, mental health. So we will circulate those to you. We will give quite limited time in order to be able to extend it after this because we never comply with deadlines, right? To receive your input on what should stay in this final document of ways forward. What are we going to do with this? The same steps that you followed before, circulated towards, again, back to you, policymakers at your level, aspire to use it also at national level and address the big underlying problems related to structural racism. Please participate in the consultation on general recommendation on health, number 37, somewhere next year. Please participate in the follow-up events that we are going to organize on the initiatives on mental health, on the activities related to improvement of data registries, administrative registries. Who was asking? Well, many people were asking about what do we do with data. You were mentioning we don't have sufficient resources to do it. Institutions have. Sometimes it's not so resource requiring to add a new variable that you register in the system. So I will leave it here, and I cannot just close without quoting one big teacher. Well, many people probably have said the same thing. We cannot bomb ourselves to peace. There are some basic rules also of physics. With the same force you don't combat a force. It has to be something opposite. Thank you so much. Thank you. Cool.
I think that closes our meeting, so we'll close our Zoom. Thank you all for coming and see you again soon. Please take the resources you see on the table. They are for your use.
Over there, the other table also there are.
And there's more resources over there in the corner. Thank you.